Italy shares the feelings and vision of many nations still affected by NTDs. Good luck for the new roadmap.
Our community stands ready to support the implementation of the roadmap by strengthening the evidence base to support new strategies.
Since 1986, we have averted at least 80 million cases of guinea worm disease.
We need to focus, act with urgency, solve the problems from root cause, and support endemic countries to achieve their goals.
The spirit and aspirations of the roadmap is aligned with our quest for universal health care, which calls for increasing coverage.
The Skin NTD's cross-cutting group is totally committed to the roadmap's principles of sustainability, accountability, and cross-sectoral partnership.
It is essential that we combine efforts and invest in collaborative approach that build capacity and promote sustainability and resilience within health systems.
Delivery of this roadmap will only become a reality with strong leadership and collaboration.
The GSA is committed to ending NTDs and supporting health for all.
We are excited about the recognition of the broader needs of patients.
Our commitment to the new roadmap is to continue cultivating and catalyzing R&D and open innovation, also working with our global stakeholders on access and delivery or partnership and delivery.
We are ready to deliver the new roadmap to support country-led decisions for STH elimination.
We will work to ensure that our 2030 strategy for zero leprosy is in alignment and that our work will enable reaching the targets.
I hope that our network can continue convincing the German government to commit themselves even more than before to the support of this crucial development.
We look forward to working closely to identify opportunities for integrated responses and interventions that can expand access to equitable and affordable care for those in need.
We clearly cannot attain universal health coverage without addressing the burden of neglected tropical diseases.
This is a tumultuous time for global health, but as chairman of the Diet Task Force, I will do my best to lead and strengthen Japan's contributions in eliminating NTDs once and for all.
The launch of this roadmap is an important step in our journey together. One step, but let us make it a major step together for One Health, and together help better the lives and livelihoods of future generations.
USAID will support the roadmap's call for sustainable NTD programs by reinforcing country leadership, strengthening health systems to deliver NTD services, and improving multi-sector collaboration.
We are very happy to collaborate with our colleagues from the Neglected Tropical Diseases Department to make sure that neglected will be a word that hopefully one day we can delete from the acronym.
We're fully committed to help achieve the global targets for 2030. Look forward to continuing our collaboration to end the neglect.
As recommended by the National Health Commission of the People's Republic of China, I'm honored to deliver this speech. First of all, I would like to congratulate the virtual launch of the new WHO roadmap for NTD.
At Core NTD, we're thrilled to see research as a component of WHO's new roadmap. We are committed to working with our partners, especially those in the countries where NTDs are endemic.
Collaboration between health, WASH, and so many other sectors is crucial to achieving and sustaining targets, as well as continuing to build resiliency within our health systems.
To support the new roadmap, we will continue to steward the donation of preventive medicines, facilitate operational research to overcome barriers.
FGS is thought to be a risk factor for the transmission of HIV, and I'm deeply concerned that up to 56 million women in sub-Saharan Africa have FGS. We must expand and integrate FGS, HIV, and sexual and reproductive health services. We must increase access to medicines that so many women urgently need.
Ensemble, nous pouvons arrêter la trypanosomiase humaine africaine. Nous pouvons mettre fin aux MTN et contribuer à une meilleure santé pour tous.
What makes us especially happy is to see that people who are affected by NTDs
are part of the strategy. They will be involved, they will be drivers, they will be owners of the strategy and also of the implementation. So thumbs up for WHO and for this roadmap, and let's all try to implement this exactly as it is written.
Through continued collaboration, the new roadmap goals are well within our reach.
Its cross-cutting approaches, proposal for change in systems, and reaffirmation of the importance of stronger accountability transpire the spirit of the SDGs.
This year has shown us that we need collaboration at government, organisation and individual level to tackle these big global health challenges.
O povo é a razão da existência do governo.
And remain committed to being the scientific home for the discussions, debates, and partnerships that not only take us to success in this year, but in the next decade to come.
Now Sudan is heading to a new era of controlling, eliminating, and eradicating NTDs.
In many cases, NTDs prevention solutions are cost-effective while having a huge impact on health and dignified life of those affected.
The UK was an active partner in the WHO consultation to develop the roadmap. We fully support its ambitions to protect people from the pain, disfigurement and poverty caused by NTDs.
As we begin a new era of collaboration to end these preventable diseases, we remain committed to working with WHO and our many partners to realize a world in which all people have equal chance to live healthy, dignified lives.
We are excited to welcome a new, ambitious roadmap that will facilitate cross-sectoral research and evidence-based innovation to accelerate NTD progress.
Somalia remains committed to achieve the Sustainable Development Goals target for the neglected tropical diseases. Therefore, we embrace the new NTD Roadmap 2030.
We at the Canadian Network are thrilled with the launch of the new NTD Roadmap.
Canadians ending the neglect.
Entendant perpétuer la longue tradition francophone de lutte contre les maladies tropicales, nous nous associons aux efforts déployés par l'OMS et aux objectifs de la feuille de route 2021-2030 pour la lutte contre toutes les maladies tropicales négligées sans exclusion.
I'm here today to express my organizations and my own full support to all efforts conducted globally and across the African continent to improve health and to achieve the UN Sustainable Developmental Goals.
I congratulate my sister Muele, the entire NTD family, the Global Malaria Program, the Malaria Fighters will stand with you, learn from you, and walk this path to 2030 together with you.
EU appreciates the new roadmap for NTDs, and we recognize and further encourage the efforts to build a strong monitoring framework to evaluate progress. Colleagues, we have a long road ahead, but now we have a roadmap. So let's get moving. I thank you.
We're all excited to see the new roadmap reaffirm WHO's commitment to eradicating yours and for the first time introduce targets for the control of scabies.
We are so pleased to join the global fight to end the scourge of neglected tropical diseases, and we look forward to working together with the NTD community to make this a reality.
L'Organisation mondiale de la santé vient de lancer une feuille de route pour les maladies tropicales négligées. La France la soutient sans réserve. Nous allons continuer à l'appuyer. C'est nécessaire si nous voulons réaliser les objectifs du développement durable à l'échéance de 2030 et la couverture de santé universelle. Bravo l'OMS.
We'll be by your side every step of the way over the coming decade to make sure this vision becomes reality.
Rabies control and elimination can actually serve as a role model for intersectoral cooperation, in particular between the human health and animal health sectors.
As we launch the global NTD roadmap, I would like to reiterate the political commitment and national leadership in Sri Lanka to end the neglect for achieving SDG 3.
This roadmap has identified and set out clear targets and milestones to prevent, control, eliminate, and eradicate 20 NTDs in the next decade. I congratulate WHO on the roadmap and call on all partners and stakeholders from across sectors to come together in partnership and to end the neglect.
It's such an important day. It's a critical report and plan. And although it's ambitious, I know that working together with endemic countries and all the other partners, We can do this.
We want to see a world free from NTDs.
At the NDI, we would like to express our full support to the NTD Roadmap 2030. We believe that partnerships are critical to achieve the ambitious goal to control and eliminate NTDs.
Government of Nepal is committed to strengthen the national health system, increase financial resources for health and enable equitable access in all aspects of treatment, care and support for patients.
Let us all rally behind the roadmap and foster universal access to innovative and affordable responses to NTDs by 2030.
The Japan International Cooperation Agency welcomes WHO's new roadmap on the neglected tropical diseases. I'd like to call on all partners to join forces to end NTDs now.
We really applaud the WHO for the leadership that they are taking. The new roadmap, I think, will be very significant. I think together we can make a big difference in neglected tropical diseases.
Let me urge that partners like WHO and others, they should support the countries in planning and implementation of strategies and approaches to help achieve the planned targets of this roadmap that we are launching today.
Greetings on this special day. Good luck to everybody as we together move towards universal health care for all. Thank you.
J'invite tous les pays frères endémiques, l'Organisation mondiale de la santé, les firmes pharmaceutiques ainsi que les partenaires techniques et financiers à se mobiliser davantage pour le contrôle, l'élimination et l'éradication des maladies tropicales négligées. Je vous remercie.
We are committed to continue our efforts, ensure resources, improve universal health coverage and equitable access to quality health services by 2030.